Right now, 3,000 additional Kaiser Permanente workers across California and Hawaii are set to go on strike, 500 of them here in San Diego. CBS 8's Jenny Day joining us live in Kearny Mesa. The strike just started minutes ago. Wow, what a crowd, Jenny. Tell us, what are you seeing out there?
Yeah, already a huge crowd at this early hour. This is now the nation's largest healthcare strike. For our local locations, we are talking San Marcos and then here in Kearny Mesa. We're at the corner of Claremont Mesa Boulevard and Ruffin Road. Like you said, there are a whole lot of caregivers out here this morning fighting for better pay and patient care. So I am joined by one of the 31,000 plus healthcare workers. Donnie Cobbler, appreciate your time. You're a physician assistant there at the orthopedic surgery office. Tell me why you're so passionate this morning.
So we're out here today. We've been out here. This is starting week 3. We're still out here. We're fighting for staffing. We're fighting for patient safety. And we're still out here because Kaiser's refusing to show up to the bargaining table. We see their emails and we see their letters come out just talking about that they're ready to bargain, but they literally haven't shown up since December 15th. So we're
8+ months. Talk to me about, really, it's just at a standstill?
It is at a standstill. Yeah, we show up to bargaining every day. Kaiser reaches out to us, tells us where to meet, when to meet, what time to meet. We show up and they literally no-show. It's been like that since December 15th. We're still in LA right now waiting for them to show up. So whenever they're ready.
Talk to me about, again, better patient care. I understand that you want more time with each patient. I've heard that many of you just feel squeezed when you're in that room with us.
Yeah, of course. So you can imagine, and I'm sure everyone can relate to this. I'm a PA who works in orthopedic surgery. Most people's complaints when they come in is they don't have enough time with their provider. They feel like they're not being heard. They feel like their issues aren't being addressed, and it's because we're being squeezed for time. They're constantly overbooking our clinics. They are short-staffed in our clinic. We're getting burned out. So right now, as a physician assistant, we're out here because we're fighting for those patients who deserve that time and deserve that care.
What would you say to Kaiser? Their statement to me says that this is the strongest compensation package in history and keeps employees among the best paid caregivers in the country.
Yeah, so that's the gaslight campaign that they've been putting on from the beginning. So all they want to talk about is the 21 versus 25%, but that's national bargaining. That's not local bargaining. We're out here for our local issues. We need better staffing. We need patient safety. And we're also paid, like, for example, the PAs, we're paid $44 an hour less than Northern California. So, but again, this isn't about the money. We're out here for the patients and we're their advocates. So that's why we're still out here.
And I do want you to know nurses have been called in from around the country. So the hospital and different medical appointments are still open. The pharmacies and lab workers are actually joining the fight today. That's why this is expanding. So that's got to feel good to have more support.
Yeah, of course. And we don't want to be out here. We want to be in there working, taking care of these patients. So because Kaiser's refusal to show up at the bargaining table, not just bargaining in good faith, but just showing up in general, now we have other people going on strike with us to push that power so we can get this done so we can go back to work and take care of them.
Nurses, little angels here on earth, so thank you to all of you, really mean it, and we'll certainly keep you posted on these developments.